there's a shortage of family doctors, right? 2.2 million Ontarians right now do not have a family physician. It is predicted that that number will go to up to 1 in 5 by 2025. Now just sit there as you digest your food and think about that for a minute. 1 in 5 Ontarians not having a family physician. That is a staggering and scary number at the same time. There's a lot of family physicians that are at or nearing retirement age. A lot of people got a bit burnt out at the pandemic and they decided to say, we've kind of had enough, we're going to retire early. And for all of the people in this room who might be more familiar, if you've been living in Canada for a long time, our guest speaker has not necessarily, but imagine the people, new immigrants, low socioeconomic status, people whose English is not their first language. Who's going to navigate the system for them when they don't have a family doctor, right? It's a big, big problem. So I really believe that access to a family doctor should be the same as access to a public school. If you move into an area, no public school is going to tell you that your child can't attend there. We should do the same thing for family physicians. So the shortage is point number 1. Point number 2, when you have a shortage, you have unintended consequences. So when we don't screen you for cancer, what happens? It's not picked up early, then it gets presented late, and then the treatment options are not as good. So you have worse health outcomes as one example. When people don't have family physicians, they go to the emergency room. So we overcrowd there. You wait 14 hours for care. We shouldn't be proud of that. And this is where we start to use up our scarce resources. So unintended consequences is number 2. Number 3 is burnout, right? So you have a bunch of family doctors that are dealing with all of this admin work. There was a study that came out about 6 months ago that said for a family doctor to look after their patients, just see their patients, keep up with guidelines, and do all the admin stuff, you need 27 hours a day. Last time I checked, we only have 24. So, it's a big problem and it's not sustainable. And we've seen this in emergency departments that are closing. Can you imagine emergency rooms closing in the northern part of this province? People get to the emerge and it says on the door, we're closed. Go to this emerge. They drive 2 more hours. Imagine it's an emergency, right? So this burnout is a big problem, and some docs, just to fill those shifts, are giving up their family practice. So it's sort of like this vicious cycle that becomes a problem. 2 more quick points. Number 1, equity. So it was mentioned that I work in a family health team, and we'll get into that in a little bit, but we need more team-based care, right? The days of you going to your family doctor to be everything to everybody, it doesn't work anymore. We need social workers, we need pharmacists, we need nurse practitioners, we need dietitians. We need everybody to work together. And right now in this province, only 25% of patients have access to those models. And yet, all of the residents we train in Ontario and all the 5 medical schools, they're all being trained in the team-based model. And then when they finish and look for a job, they're told, sorry, you can't work in that model. That's just very backwards. And finally, a little pitch for medical education. There's less medical students wanting to go into family medicine. There's less residents coming out that want to do office-based care because you got to run a business. They don't want the administrative headache. So they just want to work in the hospital or the emerge or do palliative care. All important, but that's not the comprehensive model that we sort of talk about in our training program.